Qualities of a medical assistant: dependability, courtesy, initiative, interpersonal skills. Medical profession liability. The physician-patient relationship is an implied contract in which the physician is expected to assess and treat the PT with the same amount of knowledge, skill, and judgment as another physician under the same circumstances. Rules that must be followed under physician-patient relationship. Consent to treat. Good Samaritan Act states that a volunteer is not held liable for any civil damages that may occur as a result of their efforts to provide emergency care. Patient's Bill of Rights, developed to ensure the fairness and effectiveness of the healthcare system as well as to encourage people to take an interest in the improvement of their health. -8 sections. Patient is provided with a copy on first visit or it is visibly posted within the facility. HIPAA Patient Privacy Rule establishes regulations for the use and disclosure of FI and mandates that all patients be provided a copy of privacy policies when treated in a doctor's office or when admitted to any HCF. Vocabulary. Phone etiquette. Steps to ensure proper phone etiquette. 1. Answer promptly and kindly. 2. Properly speak into phone. 3. Give caller undivided attention. 4. Speak clearly and distinctly. 5. Be courteous. 6. Ask permission before placing on hold if necessary. 7. Never get upset at an angry caller. Remain calm and composed. Verbal and non-verbal communication. Verbal, the use of words spoken, sounds, words, speaking, and language. Non-verbal, eye contact, body language, facial expressions, symbolic expressions. Appointments, considerations when selecting an appointment book. Size and consideration of desk space available, accommodation of appointments made, comfort for writing, space for details necessary. Usage of matrix. Times physician is not available, hospital rounds, meetings, days off, holidays, breaks for meals. Types of scheduling. Wave scheduling. Usually see 4 patients an hour. All are scheduled for the top of the hour and are seen in order of their arrival. Modified wave. In 1 hour time frame, 2 patients are given own specific time and 2 are told to arrive at the same time. Double booking. 2 or more patients scheduled with the same physician at the same time. Overbooking. Not good schedule planning causes many delays. Scheduling new patients. Scheduling conflicts. Types of mail. Health insurance. Verification of insurance benefits. Types of health insurance. Insurance terms. Usual, customary, and reasonable or covered expenses. An amount customarily charged for or covered for similar services and supplies which are medically necessary, recommended by a doctor, or required for treatment. Waiting period. A period of time when you are not covered by insurance for a particular reason or problem. Medical records management. Creating a medical record. 1. Determine if new or established patient. 2. Obtain required general information. 3. Enter the information into patient history form. 4. Review the form for accuracy. 5. Enter patient's name into computerized ledger. 6. Assemble forms, prepare folder and file. Components of the medical record. SOAP approach to documenting. A format for progress notes based on the letters of the word SOAP. S. Subjective impressions given by patient. O. Objective clinical evidence. Test results observed. A. Assessment diagnosis, probably diagnosis. P. Plans for further studies, treatment or management. Treatment. SOM record organization. Source-oriented medical record divided into sections, laboratory, progress notes, etc. in chronological order. Most recent is on top in each section. POM record organization. Problem-oriented medical record. Problems are numbered as database, demographics, profile history, CC, past assessments and test results, treatment plan, procedures, medications, instructions, progress notes, continuous care notes. Filing indexing rules. Alphabetical filing. Folders are arranged in the same sequence of the alphabet. Ensure the filing cabinet has enough space for proper distribution of files within each letter. Numerical filing. An alphabetic cross-reference is used to categorize materials with digits. Patients are assigned in a consecutive order. Records are filed backwards in groups. X. Terminal digit filing. Subject filing. Either an alphabetic or alphanumeric code is assigned to general correspondence. Tickler file. A collection of date-labeled file folders used as a reminder for time-sensitive matters or other important information. Used as a follow-up method. Check daily. Medical terminology. Combining forms, prefixes and suffixes. ARTHRO. Joint. Bio. Life. Cardio. Heart. Carcino. Cancerous. Cephalo. Head. Cerebro. Cerebrum. Cyto. Cell. Dentio. Teeth. Dermo. Skin. ELECTRO. Electrical activity. Entero. Intestines. Feto. Fetus. GASTRO. Stomach. Hepato. Liver. Iatro. Treatment. Physician. Leuco. White. NEPHRO. Kidney. Osteo. Bone. Patho. Disease. Reno. Kidney. Rhino. Nose. Sarco. Flesh. Thromo. Clotting. Uro. Urinary tract. Al. Pertaining to. Algia. Pain. Dynia. Pain. Ectomy. Excision. Removal. Amaya. Blood condition. Genic. Produced by / pertaining to producing. Globin. Protein. Itis. Inflammation of. Oma. Tumor. Osis. Condition usually abnormal. Pathy. Disease condition. Cis. State of condition. Ectomy. Removal of. Graphy. Process of recording. Metry. Process of measurement. Scopy. A visual examination. Stomy. A new opening. Tomy. Incision. Tripsy. Process of crushing. Graph. Instrument for recoring. Meter. Instrument to measure. Scope. Instrument to visually or orally examine. Tome. Instrument to cut. Tripter. Instrument to crush. Trite. Instrument to crush. Anti. Before. In front of. Anti. Against. Britty. Slow. Dia. Through. Complete. End. Endo. Within. Epi. Above. Upon. Hyper. Excessive. Above. Hypo. Deficient. Below. Peri. Around. Surrounding. Pre. Before. Sub. Below. Under. Body systems. Systems are groups of organs working together to perform complex functions. Viscera is the term for internal organs. Musculoskeletal system. Functions: support, movement, protection, organs, muscles, bones, joints, bone marrow. Integumentary system. Functions: protection organs, skin, hair, nails. Gastrointestinal system. Functions: nutrition organs, stomach, intestines. Urinary system. Functions: elimination of nitrogenous waste organs, kidneys, bladder, ureters, urethra. Reproductive system. Functions: reproduction organs, ovaries, testes. Blood lymphatic system. Functions: transportation organs, blood cells. Immune system. Functions: protection organs, lymph glands. Cardiovascular system. Functions: transportation organs, heart, vessels. Respiratory system. Functions: delivers oxygen to cells and removes carbon dioxide, organs, lungs, bronchi, trachea. Nervous behavioral system. Functions: receive, process information, organs, brain, nerves, mind. Endocrine system. Functions: affects changes through chemical messengers, organs, pancreas, thyroid. Body cavities. 5 cavities: cranial, spinal, thoracic, abdominal, pelvic. Cranial cavity. Brain, dorsal cavity, on posterior of body. Spinal cavity. Spinal cord, dorsal cavity, on posterior of body. Thoracic cavity. Contains 2 smaller cavities, pleural and mediastinum. Ventral cavity, on anterior of body, pleural, space surrounding each lung. Mediastinum, contains heart, aorta, trachea, etc. Abdominal cavity. Stomach, small and large intestines, spleen, pancreas, liver, and gallbladder. Ventral cavity, on anterior of body. Pelvic cavity. Rectum, urinary bladder, urethra, ureters, uterus and vagina in females. Ventral cavity, on anterior of body. Abdominal and pelvic cavities. There is nothing separating these 2 cavities, often referred to as the abdominopelvic cavity. Thoracic and abdominal cavities. The diaphragm separates these 2 cavities. Planes of the body. Dividing the body into planes or flat surfaces is an additional way to describe the body. Sagittal plane, mid-sagittal plane, frontal plane, transverse plane. Sagittal planes. Vertical planes that separate the sides from each other. Mid-sagittal plane. Separates the body into right and left halves. Frontal plane. Divides the body into front and back portions. Transverse plane. Divides the body horizontally into an upper and lower part. Positional and directional terms. Musculoskeletal system. Includes bones, muscles, and joints. Bones are connected to one another by ligaments. Muscles are attached to bone by tendons. Acts as a framework for the organs, protects many organs, and provides the ability to move. Bones. Complete organs made up of osseous, a connective tissue. Inner core is comprised of hematopoietic tissue. Types of bones. Categorized as belonging to either the axial skeleton or the appendicular skeleton. Axial, appendicular, long bones, short bones, flat bones, sesamoid bones. Axial bones. Skull, ribcage, and spine. Appendicular bones. Shoulder, collarbone, pelvic, arms, and legs. Long bones, very strong, broad at the ends, and large surfaces for muscle attachment, humerus and femur. Short bones, small with irregular shapes, found in wrist and ankle. Flat bones, covering soft body parts, shoulder blades, ribs, and pelvic bones. Sesamoid bones. Small, rounded bones found near joints. Increase efficiency of muscles near a joint, kneecap. Axial skeleton. Skull, spine, ribcage. Skull is made up of 2 parts, the cranium and facial bones. Cranial bones. Facial bones. Spinal vertebral column. Divided into 5 regions from neck to tailbone. 26 bones in spine called vertebrae: cervical, thoracic, lumbar, sacral, coccygeal. Cervical, neck bones. Thoracic, upper back. Lumbar, lower back. Sacral, sacrum. Coccygeal, coccyx. Ribcage. 12 pairs of ribs. First 7 pairs join the sternum anteriorly. Trough cartilaginous attachments called costocartilages. True ribs. Number 1-7 attach directly to the sternum and the front of the body. False ribs. Number 8-10 are attached to the sternum by cartilage. Floating ribs. Number 11 and 12 not attached at all. Appendicular skeleton. Upper appendicular skeleton includes shoulder girdle, which is made up of the scapula, clavicle, and upper extremities. Scapula, shoulder blade, flat bone that helps support the arm. Clavicle, collarbone, curved horizontal bones that attach to the upper sternum at one end, help stabilize the shoulder. Upper extremities. Lower appendicular, divided into the pelvis and the lower extremities, pelvis, ischium, and pubic bone. Pelvis, superior and widest bone. Ischium, lower portion of the pelvic bone. Pubic bone, lower anterior part of the bone. Lower extremities. 1. Femur, thigh bone. 2. Patella, kneecap. 3. Tibia, shin. 4. Fibula, smaller, lateral leg bone. 5. Malleolus, ankle. 6. Tarsal, hind foot bone. 7. Metatarsal, midfoot bone. 8. Phalanx, toe bones. 14 total. Joints. Parts of the body where two or more bones of the skeleton join. Different joints have different ROM, ranging from no movement to full ROM. No ROM. Most synarthroses are immovable joints held together by fibrous tissue. Limited ROM. Amphiarthroses are joints joined together by cartilage that is slightly movable, such as the vertebrae of the spine or the pubic bone. Full ROM. Diarthroses are joints that have free movement. Ball and socket joints and hinge joints are common diarthrosis joints. Synovial joints. Free-moving joints that are surrounded by joint capsules. Many have bursae that are located between the bones of the joint and the tendons that hold the muscles in place. Muscles. Muscles are tissues composed of cells, have the ability to contact and relax, has 3 functions. 1. Allow skeleton to move. 2. Responsible for movement of organs. 3. Pump blood to circulatory system. Tendons. Strong fibrous bands of connective tissue that attach muscles to bones. Muscle actions. Fractures. Broken bone most occur as a result of trauma. Some diseases like cancer or osteoporosis can also cause spontaneous fractures, classified as simple or compound. Simple fracture does not rupture the skin. Compound fracture punctures the skin. Types of fractures. Integumentary system. Sebaceous glands and pseudophorous glands produce secretions that allow the body to be cooled or moisturized. Nerve fibers help the body to adjust to the environment by sensory messages relayed to the brain and spinal cord. Also help blood vessels to dilate and sweat glands to produce sweat. Epidermis, dermis, and subcutaneous layer, the 3 layers of the skin. Epidermis, thin, cellular membrane layer that contains keratin. Dermis, dense, fibrous connective tissue that contains collagen. Subcutaneous layer, thick, fatty tissue. Hair, nails, and glands, hair fibers, composed of tightly fused meshwork of cells filled with hard protein called keratin. Hair follicles. The hair has its roots in the dermis and together with their coverings is hair follicles. Main function of hair is to assist in the regulation of body temp. It holds in heat by standing on end and holding a layer of air as insulation. Nails. Cover and protect the dorsal surfaces of the distal bones of the fingers and toes. Nail body. The part of the nail that is visible. Nail root. Under the skin at the base of the nail. Nail bed. Vascular tissue under the nail that appears pink when blood is oxygenated and blue-purple when it is oxygen deficient. Lunula. The moon-like white area at the base of the nail. Aponicum. The cuticle of the nail. Sebaceous glands. Located in the dermal layer of the skin over the entire body except for the palms of the hand and soles of the feet, secretes an oily substance called sebum. Sebum. oily substance that contains lipids that help lubricate the skin and minimize water loss. Sweat glands. Tiny coiled glands found on almost all body surfaces, most numerous in palms and soles of feet. Coiled sweat glands originate in the dermis and straighten out to extend out through the epidermis. Two types: eccrine and apocrine sweat glands. Pore, the tiny opening on the surface of the skin. Eccrine sweat glands. Secreting glands, far more numerous and are abundant on palms, soles of feet and forehead. Each is a simple, coiled, tubular gland. Ducts connect to pores. Sweat, 99% water, NaCl, vitamin C, antibodies, dermcidin, metabolic wastes. Apocrine sweat glands. Located mainly in skin of axilla, groin, areolae, and bearded facial regions of adult males, open at hair follicles. This sweat is secreted during emotional stress or sexual excitement, called cold sweat. Integumentary vocabulary. Common medical record abbreviations. Telephone message. Name of person whom the call is for, date and time of call, name of individual calling, caller's phone number they wish to be reached at, detailed reason for call. If caller wishes to leave, reason, action required, initials of person taking the message. Size of general business correspondence paper, 8.5 inches x 11. Business envelope, number 10. Email. If patient-related, remains confidential. Hard copy placed in patient chart. Contents of medical record. Personal demographics, medical history, progress notes, encounter form, superbills, radiology reports, laboratory reports, consultations, med sheet including allergies, hospital discharge summaries, consent and disclosure forms, insurance authorizations and referrals. Making a handwritten correction in the medical record. Record maintenance. Always verify correct medical chart has been pulled. Mend chart as necessary. File documentation in a timely manner. Make sure required forms are kept up to date. Verify patient information periodically. Retention of records. Laws regarding retention vary from state to state. -10 years or length of time on statute of limitations. Minors, 3 years after age of majority. Medicare Medicaid patient, a minimum of 6 years. Deceased patient, 2 years. Classification of records. Active, currently receiving treatment. Inactive, not seen for 6 months. Closed, moved, terminated, or deceased. Types of files. Drawer files, shelf files, rotary circular files, lateral files, compactable files, automated files. Filing supplies. Chart covers or folders, labels, color-coded, alpha and numeric code guides, special notation labels, allergies, same name, CAPAs, primary care physician. Filing procedures. Conditioning, releasing, indexing and coding, sorting, storing and filing. Conditioning files. Mending damaged records, removing pins, paper clips, brads, staples, stapling related papers together. Releasing files. Indication that the record is ready to be filed. Signature, initials, date, stamp. Indexing and coding files. Deciding where document is to be filed. Underline name or subject of how it is to be filed. Every paper in patient's chart should have a name and date. Sorting files. Arranging papers in a filing sequence. Alphabetical, numeric, days of the week, days in the month, months of the year. Storing and filing files. Inserted face up, most recent date on top, document completely in file. Locating misplaced files. Missing document only in the folder in front of or behind the correct folder, between folders, under the files. Patient with a similar name. Entire medical record. Physician's desk, billing department, nursing station, office manager. 12 rules of indexing. Which block is the physician's signature located in? Block number 31. OCR. Federal government division that enforces the privacy standards. How many provisions does HIPAA contain? 2. Sentinel event. An unexpected occurrence involving death or serious physical or psychological injury or the risk of the mistaken identity of a patient. Subjective information. Information that is documented in the medical record, that is from answers obtained by asking questions from the patient. Patient's family history. How many diagnoses can the CMS 1500 form have? 4. Why is it usually poor policy to accept third-party checks from patients? You cannot verify the reliability of the maker. JCAHO, the non-profit organization that assists healthcare facilities by providing accreditation. Audit, the process done before claims submission to examine claims for accuracy and completeness. Medicare Part D, drug services. Legal owner of the patient's medical record, the physician or agency where services were provided, the maker of the record. TRICARE, health insurance designed for military dependents and retired personnel. FICE stands for Protected Health Information. Hard copy, a claim that is printed and mailed to the carrier. Healthcare information is used to determine how many patients enter a facility with the same diagnosis, decide what equipment is needed to meet the needs of the patient population, help the facility plan for the needs of next week and next year. Medicaid, the federal and state-sponsored health insurance program for the medically indigent. Workers' compensation, a type of insurance that protects workers from lost wages after an industrial accident that happened on the job. Professional courtesy, charging reduced or no fee for services rendered to other medical professionals. Assets, the properties owned by a business. Medicare Part B, physician office visits. Accounting, a system of recording, classifying, and summarizing financial transactions. Blanket position bonding, covers all employees in a facility. Patient privacy complaints. Patients have 180 days from the time the patient knew the act occurred to file a complaint. Common appointment book abbreviations. CPE CPF, complete physical exam, NP new PAT, new patient NS, no show PX, physical RV, office visit LFU, follow up REC, recheck REF, referral CAN, cancelled N and V, nausea and vomiting PGT, pregnancy test RS, reschedule. Common time slots for appointments. Physical, 1 hour school physical, 30 minutes recheck, 15 minutes dressing change, 10 minutes BP check, 5 minutes patient teaching, 30 minutes - 1 hour. What must a letter of withdrawal of care state? That professional care is being discontinued. The physician will provide copies of the patient's records to new physician. The patient should seek new care provider as soon as possible. How should a letter of withdrawal be mailed? Certified. U.S. Supreme Court, the ultimate appellate court in the United States. Ways to increase appointment show rates. Automated call reminders, appointment cards, confirmation calls, email reminders, mail reminders. Medical term for a stroke, cardiovascular accident. Suspected diagnosis, a diagnosis that is questionable, probable, or likely. E-codes, codes that describe the circumstances of an accident or injury. Where should you begin the search for a code? Alphabetic index. Etiology, the cause of a disorder. Manifestation, the signs and symptoms of a disease. ICD-9 codes consist of 3 primary digits and up to 2 additional digits. Benign, a non-malignant cancerous growth. CBMR, computer-based medical record. Shingling, the method of filing in which one report is laid on top of older reports. V-codes are the codes that refer to factors that influence the health status of a patient. A definite diagnosis cannot be stated, but a valid reason for seeing the provider exists. Continuity of care, continuation of care smoothly from one provider to another so the patient receives the most benefit and no interruption in care. CC Nature and duration of pain. If anyone's symptoms were first noticed by patient's opinion of causes of problem. Remedies patient may have applied. Patient has had similar condition in the past. Other treatment received for condition in the past. Differential diagnosis. The process of weighing the probability of one disease causing the patient's illness against the probability that other diseases are causative. Cheddar. C. Chief complaint. H. History. E. Examination. D. Details. D. Drugs and dosages. A. Assessment. R. Return visit information, if applicable. Medicine and Law Act. The formal action of a legislative body, a decision or determination of a sovereign state, a legislative council or a court of justice. Allegation. A statement by a party to a legal action of what the party undertakes to prove, an assertion made without proof. Nosocomial infection, hospital-acquired infection. NCHS. Collects data from birth and death records, medical records, interview surveys. Health Statistics Agency. Mission. Provides statistical information that guides actions and policies to improve the health of American people. Clustering. Patients with similar problems are booked consecutively. A block of time is set aside for particular types of cases. Underuse of medical care. When doctors or hospitals neglect to give patients medically necessary care or to follow proven healthcare practices. Misuse of medical care. Medical errors. When patient doesn't fully benefit from a treatment because of a preventable problem or when the patient is harmed by a treatment. Overuse of medical care. Occurs when a drug or treatment is given without medical justification. HITECH Act. Health Information Technology for Economic and Clinical Health Act. Purpose of HITECH Act. Designed to increase safeguards that will protect the privacy of a patient's file from being compromised. UT folder. A folder used to provide space for the temporary filing of materials. UTGUIDE. A heavy guide used to replace a folder temporarily removed from the filing space. How does OSHA regulate and enforce safety and health in the workplace? By setting safety standards. Addendum. An error discovered at a later date.